Hi, my name is Anna, and I'm going to talk about work that we did looking at the admission rates for acute type A aortic dissection during influenza season, as well as the impact of influenza vaccination on COVID-19 infection rates and severity. There's been found to be an increased incidence of type A aortic dissections during the winter months that has been shown to be independent of climate and temperature. So we hypothesized that this association might be partially explained by an increase in flu activity during the winter months. Additionally, the influenza vaccination is known to be safe and effective, and we wanted to look at its role, the role that it may play in COVID-19 infection rates and severity. We obtained monthly admission rates for acute type A aortic dissections and lab-confirmed cases of influenza, as well as the Michigan-specific influenza trends from 2009 to 2019 from the CDC. We categorized months as either high influenza activity or low influenza activity and compared the rates of acute type A aortic dissection between the groups while controlling for temperature. Additionally, we looked at the association of influenza vaccination with positive COVID-19 testing and COVID-19 clinical outcomes. We found a significant association between influenza activity and acute type A aortic dissections, with 4.81 acute type A aortic dissections occurring during the high influenza activity months, compared with 3.47 during the low influenza activity months. Additionally, we found significantly higher in-hospital and 30-day mortality in the patients who presented for acute type A aortic dissections during the high influenza activity months. We found a significant reduction in the odds of testing positive for COVID-19 in the patients who received an influenza vaccine compared to those who didn't receive the vaccine. Additionally, patients who tested positive for COVID-19 and received an influenza vaccine were less likely to require hospitalization, mechanical ventilation, intensive care, and also had a shorter hospital length of stay than those who did not receive the influenza vaccine. Here's a graphical representation of our results. There's a significant difference in all of the clinical outcomes that we looked at, except for death. There was no significant difference between the vaccinated and unvaccinated groups. We demonstrate a positive association between regional influenza activity and admission rates for acute type A aortic dissection that's independent of temperature. We also found influenza vaccination to be associated with decreased positive COVID-19 testing and improved clinical outcomes. Therefore, there should be increased promotion of the influenza vaccine in order to decrease the risk of influenza-related cardiovascular events and also to provide a potential protective effect against COVID-19 infection.